go for a while. So there'll be no pregnancies with the vasectomy. 100% effective.
And if a man decides later on in life that he has changed his mind for some reason beyond my knowledge,
right,
he can have the vasectomy reversed.
Well, and women cannot have a tubal ligation reversed.
That is a myth. A tubal ligation also can be reversed.
I was
like
watching
$40,000. And the complications are much more.
Am I speaking of? Oh, no, excuse me, not a tubal ligation, but a tubal bisectomy. When they cut the fallopians, that is irreversible.
And they can't connect them.
Exactly.
Right? And then they don't have the little flowers at the end where the egg comes down. And
exactly.
comes out,
correct.
Flowers. Anyway, we females understand that.
So I'm just saying it would be easier for a man to get than
yes.
women.
And if they do decide to reverse their vasectomy, there's a 45 to 60% chance that it will be effective and that they will be able to bear offspring.
What's the chance?
45 to 60%. Go back to having fertility.
About half.
So, yeah.
No more than that.
Yeah, you could say between 45 and 50, and if you combine them, you probably got 50%. So, say if you're, spanking the monkey, and, doing your thing, and you're, I think.
Working it out. Working it out, yeah.
So sperm going, well, man, he's back. Look, my friend's back. Vagina.
Oh, yeah.
Okay, I don't know.
Egg cones. Let's fertilize.
Okay, do we need to learn about the cremaster muscle, which surrounds the testes?
Does this end the show on vasectomy?
The testes during sexual stimulation and exposure to cold.
Excuse me, but Nurse Coop,
yes.
Is the vasectomy chapter of our lesson over? Because
are there any questions left?
Anyone?
Anybody? Oh, you over there.
Well, my husband, we want him to get a vasectomy, but he only has one ball. Will that affect the vasectomy in any way that he only has one testicle?
Absolutely not. If he has one testicle, absolutely he's still able to bear offspring, just as many as if he had two testicles.
So, but it won't, we don't want no more kids. Last one had fetal alcohol syndrome, to be honest with you, because I was drinking a half-gallon of vodka a day. But I don't want no more kids, because the kids I got, the eyes are all far apart and the weird nose.
Right.
So, would you say my husband has would have the lowered, chance of getting me pregnant after a vasectomy? You say I have a better chance of staying unpregnant with fetal alcohol kids because my husband has one ball. It doesn't make no difference since it's 100% effective.
Yes, he may even actually have the other ball just taken off. Just call it good. That's kind of my advice on that. Thank you. Any other questions?
Yeah, so, but wouldn't it be, more bloody and danger? Wouldn't there be more danger of surgical complication if she had her husband's other ball cut off rather than just the simple inpatient procedure of a vasectomy?
I think if they do it together and she pours enough of her alcohol on it while they do it, there'll be no chance of infection, and it'll probably kill off any kind of remaining.
Just tie a string around it.
Yeah. You could probably do it the old-fashioned way, and just kind of like they did the teeth, in the olden days, tie the string around the tooth and then to the doorknob, and then slam the door, and the tooth will come out. And you could probably do that with that other testicle. And you might want to twist it a bunch first, so it
All right. So is that going to be?
Might be a little painful, just for a minute or
No.
two.
But the vodka.
But the vodka, exactly. See, bless your heart. You know, you don't even need a doctor. Huh? Why do you need me? Bless your heart.
So that
Okay.
would be the end of the
I think-
episode about vasectomies.
Yeah, I think if everybody understands, you can still get it up the same. You still have a massive quantity of cum coming out. You still have your build-up, so you've got your needs. And other than that, I think it is the best thing that you can do for your woman, because it keeps her out of having to have surgery and taking a whole bunch of pills and getting all jacked up because now she's got to go home from surgery where they've been waiting on her for 2 days.
She gets hooked on the fucking pain pills.
Yeah, and now she's got to go home and do laundry and dishes and then look at your sorry ass because you wouldn't get your frickin' balls fixed. Hello, it's just
Nurse Coop,
Oh!
I think you're getting a little personal.
I'm getting carried away. And you know what I forgot? I forgot really the most basic thing that people would probably want to know. Like, how do they do it? You know, you go in the doctor's office and you lay on the cold linoleum kind of table.
Metal, probably.
Probably metal. Yeah. In the men's office, it's often metal. And what they do is they have you stripped down with everything, so you just lay in there bare naked, nothing, you know, and they, you know, pull up
small penis and all.
Pull up your wanky wank, you know, and they get right under there, and you can see the vein, you know, you can see the vein.
Wow.
You know, you can see it right under there, and it's just like a clip, and they go in and they just make a snip, and that's it, snip, and then you come back 2 weeks later. And you got to go jack off in the bathroom, and you give them a cup sample of your sperm, and they want to see, you know, if your cum has any sperm in it or not, or if they did the job. So there will actually be a test at the end to see if the job was really completed.
Like a quiz.
It is. It's like a quiz and finding out
First you get snipped by balls, then you want me to take a test? Jesus Christ.
It's a harsh one, but it saves us women. And we will really, you know, we'll give you some damn good blowjobs, you know, because sometimes that sperm is really salty.
Better.
So, you know, when that's out of the picture, you know, you can get some good loving. So, thank you, men.
The Nurse Coop.
It is true that you have witnessed the first viewing of the Nurse Coop Show.
Until then?
Until then,
take care of yourself.
Take care of yourself, your bodies.
And your wiener.
And your wieners, especially for tonight, since our topic is wieners.
Good night.
Good night.